So deep sea physiology, at the sea level we have atmospheric pressure of 1 atm. As you move deeper, for every 10 meter 1 atm increases. For example, at the sea surface you have 1 atm, at 10 meter you have 2 atm, at 20 meter you have 3 atm. So now tell me, at 90 meters how many atm? What are you saying? 9 atm? No, 10 atm. See, at the 10 meter 2 atm, 20 meter 3 atm, 30 meter 4 atm. So 90 meter 10 atm, because 1 atm is at the surface of sea. These are also MCQ in your examination. Now as you move deeper, 1 atm will increase, and this will cause compression of gas. So on sudden decrease of pressure, it can form bubble. For example, if someone goes deeper in the ocean, there is dissolving of all the gases, and suppose suddenly he comes out, they cannot come out easily, so they will form the bubble, and these bubbles can cause decompression sickness or caisson disease or dysbarism. What is the treatment? Put the person in a hyperbaric chamber, increase the pressure so that all gas will again be dissolved in the blood, and release it slowly, so that gas will come out naturally. And how it can be prevented? You must counsel the divers that you should go slowly, come slowly. Okay, this is the reason that some people have caisson disease who are divers. But what is nitrogen narcosis? Nitrogen narcosis is different from caisson disease. Those person, it is in the same person, but it is because of person who are working under the sea for longer time, for longer times. They keep on working there 1 hour, 2 hours, 10 hours. So nitrogen will get dissolved in the body fluid for longer time. It also get dissolved in the myelin sheath of the neuron, and it has high affinity for the lipids, so it dissolved in the neuronal membrane, and this is called as nitrogen narcosis. It is similar to the alcohol intoxication. His wife will say, you have taken alcohol. He will say, no, it is because of nitrogen narcosis, because it will enter in the myelin sheath and it will look as if he is intoxicated with alcohol. Now bubbles can enter, about the caisson disease I am telling you, these bubbles can enter in the tissue, muscle, tendon, joint, leading to the pain. They are called as bend. They can cause dyspnea, they can cause chokes, but the most common cause of death is air embolism. Now space, when you are going towards the earth, distance is decreasing, it is called as positive G. When you are going away in the space, influence of gravity decreases, it is called as negative G. So if you are going towards the earth, gravity will act from head to toe, decrease the cardiac output, and it will cause gray out. It will cause blackout or gray out when you are going towards the earth. And when you are going away from the earth, all blood will go in the retina. It is called as red out. It is called as red out. So when distance is increasing, when you are going out, it is called as negative G. If you are going away from the gravity, blood goes from foot to the head, eyes and brain will get congested. It is called as red out. So when you are going towards the earth, black out. When you are going away from the earth, it is called as red out. So what is blackout? Towards the earth, towards the gravity. What is the this is the blackout. What is the gray out? I mean the red out, when you are going away from the gravity of the earth. Now what is the zero gravity? If you are in the zero gravity, what is the problem? Bone mass will decrease, muscle mass will decrease, and work capacity will also decrease. Now mountain sickness, at high altitude we have discussed, hypoxia will stimulate peripheral chemoreceptors. It will cause increased respiratory rate. It will cause carbon dioxide washout. It can cause compensatory metabolic alkalosis. And already we have discussed, when there is alkalosis, it can cause tetany. So there can be tetany also when someone is at mountain. Now hypoxia. Now if someone is living in the mountain for 1 week, 2 weeks, 3 weeks and is happy. So what are the acclimatization? The good things. Your body start accommodating for that, and that is called as acclimatization. RBC count will increase, hemoglobin count will increase. Why? Hypoxia at the mountain is the most potent stimulus for erythropoietin. Number 2, release of vascular endothelial growth factor at the mountain will increase your angiogenesis. More blood cell will come. Number 3, increase in the diffusion of gas and also DLCO will happen, and increase oxygen utilization at the level of cell by increasing mitochondrial enzymatic activity. Acute mountain sickness occurs within 6 to 12 hours of onset. He can have nausea, vomiting, headache. So what is the first thing that should be done? Descend to the lower altitude immediately. The first treatment is descent. You should not ascend from the sea immediately, but you have to descend from the mountain immediately. If severe, it can affect the lung. There can be lung edema. It is called as HACE, high altitude pulmonary edema. There can be brain edema called as HACE, that is HAPE, high altitude pulmonary edema. It is high altitude cerebral edema. Oxygen support is to be given. Calcium blocker like nifedipine can be given. We can give steroids like dexamethasone and acetylzolamides. Chronic mountain sickness is same, but it happens after 1 week like that. We can have pulmonary hypertension, not hypertension can be there. Okay, and treatment is the same. Acetylzolamide, it will release the bicarbonate, lead to metabolic acidosis. It will cause respiratory alkalosis, so cause hyperventilation. So when you are giving acetylzolamide, it is carbonic anhydrase inhibitor. It will cause release of bicarbonate. It will cause metabolic acidosis, compensatory respiratory alkalosis. It will cause hyperventilation. It will release all carbon dioxide. It will prevent respiratory acidosis. So this is how these treatments are working. Thank you.